So welcome guys to the thoracic topics. So we shall start with lungs today. So the topic is on lungs. So the lungs are highly elastic and spongy texture. Lungs basically have two components, respiratory component and elastic component, that is the connective tissue component. And respiratory component contains the alveoli, respiratory bronchioles, and further bronchioles, bronchi, conducting part of the bronchial tree. All these contains the respiratory part, whereas the non-respiratory component contains the connective tissue, and which is mainly made up of elastic tissue. That is the reason we see the recoiling of the lungs during expiration. But in chronic smokers, this elastic tissue is replaced by collagen tissue and or fibrous tissue, which doesn't allow the lungs to recoil completely, leading to pulmonary failure, chronic pulmonary failure, or chronic pulmonary disease. So that is the reason we understand in chronic smokers the elastic tissue is replaced by fibrous tissue. And at birth the lungs are rosy pink in color, and in adults it is dark salty gray because it is deposited by the carbon particles because of the pollution we inhale every day. Parts, generally the lungs has the apex, it is roughly pyramidal in shape, having apex, anterior border covers the heart, and except on the left side we have got the cardiac notch, and inferior border surrounds the base of the lungs, surrounds the diaphragmatic surface, and the surface is the coastal surface of the lungs. The posterior border of the lungs is blunt and it is called vertebral border, and anterior border is thin, which is related to the heart and the mediastinum. So mediastinal part impressions, this is very important. The right lung, we are seeing here the right lung mediastinal relations. So here is the hilum of the right lung. So structures passing through the hilum of the right lung. So right lung, the principal bronchus, before entering the lung itself, it divides into epartial and hypartial bronchus. So it divides into epartial and hypartial bronchus. You can remember abbreviation as BABU. So you can make it as V. So B is for epartial bronchus, then A is for the pulmonary artery, B is for hypartial bronchus, and V is here the pulmonary veins. So this is how the order is inside the hilum of the right lung. So first will be the epartial bronchus, then pulmonary arteries, hypartial bronchus, and pulmonary veins from above downwards. And further we can see the reflection of the pleura continuing below the hilum as the pulmonary ligament, which I have already explained in the pleura about this pulmonary ligament. And around the hilum we see a groove. So this groove is for the arch of azygous vein. So arch of azygous vein makes the groove which is called as azygous groove or azygous sulcus, which drains into superior vena cava. So we can see the impression of superior vena cava, and we can also appreciate the impression here formed by the right part of the heart. Right atrium is mainly related, and little part by right ventricles. And posteriorly near the apex above we see the trachea. Posterior to the trachea is the impression of the esophagus, which continue down as the impression of esophageal, which is the esophageal impression. So now we shall understand still more in detail. So cardiac impression formed by the right atrium and little part by right ventricle, and we see the inferior vena cava, groove for inferior vena cava, then the formation of superior vena cava and termination of azygous vein into the superior vena cava, and right brachiocephalic trunk, and trachea, which bifurcates at the level of sternal angle or the Lewis angle. So trachea, and we can also appreciate the esophageal impression made by the esophagus. So here is the esophagus.